I strongly advise you to look at sample tests on National Board website. It does help you to know how they distribute the questions. There's some questions in embryology, there's some questions on ligaments, there's some questions on muscles, and how they set the questions. They give, like they might ask you, what is the delta tuberosity? Which bone is it on? They give you choices like lateral medial of the humerus or medial anterior of the humerus. I didn't expect such questions, but we do have such questions. When you do the bones, you need to know where they are. What I want to do today is review with you ligaments, which carries a big portion of this in both spinal and also in anatomy. One of the things that I feel maybe we need to review also is embryology part of anatomy. And that's another place that we may not have done too good. So I will go ahead and pull up room 40. I think this is room 40.
Yeah.
Hey. Hello. Okay, so let's review ligaments and joints, unlike joints, and those are kind of wonderful things that you're familiar with. So the first thing I want to think about are fibrous joints, which is a review to you. Which ones are movable, which ones are immovable. You can find that from Clinical-Oriented Anatomy by Dr. Moore. First of all, let's do the 4 different types of fibrous joints. This is a review for you. The first one is suture joints. Are they movable or immovable? They are immovable. They are mainly found in skull. All right, another name for that would be Jantre fibrosa. The second type of fibrous joints would be peg in the socket, but you also need to know the name, kyphosis. This is mainly found in teeth. Is it movable or immovable? Slightly movable, very slightly movable. The third part of the fibrous joint are cleft or plate joints, also called synclisthesis, found mainly in the septum area. Are they movable or immovable? Slightly, very slightly movable. And the last part of this are synsmosis joints, which are the most movable of fibrous joints. So far so good. We keep plugging on. All right. We come to the 2 types. This is one of the questions on the board sample questions. It's one of them. The synchondrosis joint is found between the epiphysis and metaphysis. It is a temporal joint, and it's going to classify as the individual growths. So every part you see, when we talk about the head versus the anatomical head versus anatomical neck versus the surgical neck, this is anatomical neck. That's where that joint is found. In younger children, when you take the x-rays, you see that joint open. So that's called synchondrosis joint. It's primary. This was also the sample test. Cartilaginous joints are also disc joints, mainly found in pubic symphysis and IBDs. So that's the cartilaginous joints. Cartilaginous joints we only talk about 2. Fibrous joints we talk about 4. The synovial joints are 6 or more. All right, we have things like gliding joint. Mostly referred to as anthrosis. These are the choices it will give you. Anthrosis or articuloplanar. I've not seen articuloplanar being offered as a choice, but arthrosis is being offered as a choice. This one just moves a little bit in different paths. Now will be the synovial joint. Pivot joint is where and where? Where do you find pivot joints? Elbow and C1, C2. So when I do this, the radius is moving. The radius is moving. It's moving. It's moving. So it starts from here. It's actually rotating, rotating, rotating. It's rotating on the ulnar notch up to there. So that is a pivot joint. And you also need to know the word trochoid. Reciprocal reception or saddle joints. These are the metacarpal of the thumb or the trapezium. It is, they are like this on each other. And those joints will move just a little bit, not too much, so you can't force it to go too far away. That's again a synovial joint. All right, then we come to the hinge joint, so-called ginglymus, this one. Mainly found between the knee and the elbow. This is one plane movement. This is the hinge joint or ginglymus joint. We have the knuckle joints or condyloid ipsiloid. In the sample test, they used the word condyloid. They did not use ipsiloid. But again, that just shows you the attachment joint. So this is where you have a concavity and a convexity coming into each other. And that's the joint we're talking about. So we have joints like the scaphoid on the radius, and the radius will end as a concave. The scaphoid will come in as a convex. And it's good for you to know that the most subluxated bone in the hand is the scaphoid. All right. The air is also called the ellipsoidal joint. The bone in the socket is also called enanthrosis. And in anthrosis, you have the femur into the ilium, or the humerus into a glenoid fossa. So 6 synovial joints, 4 fibrous joints, 2 cartilaginous joints. So far so good? All right, let's go on to the ligaments. Ligaments. Ligaments also play a central part in your anatomy exam. So we'll look at the ligaments from the top to the bottom. Some of them are pretty clear. If they test you in it, you can think through it and make an educated guess. Some of them you don't know where they are, we need to look for them. So in the elbow joint, this one right here, we have the following ligaments. These are common ligaments, so I will not stay too much on them. Acromioclavicular joint has a acromioclavicular ligament. So that one you can make an educated guess. Is that correct? Then we have the trapezoid ligament and the conoid ligament. Now, those ones are referred to as one ligament. It's actually called the coracoclavicular ligament. The trapezoid line, which you studied, I think, in first quarter, has the trapezoid ligament. The conoid tubercle has the conoid ligament. So trapezoid ligament is lateral, conoid ligament is medial. The two of them make the coracoclavicular ligament. All right, then we have the capsule around it. There are 2 openings into this capsule. One of the openings is when the long tendon of the bicep brachii goes in, and another one is where the bursa comes in. Those are the only openings in this. I will refer that. So this is the first opening you get in here. The second opening is you get. Those are the only openings that go into this capsule joint. The ligament I want you to know on this one that may not be guessable is the transverse ligament. Here it is. This is the transverse ligament. The transverse ligament is here. And what it does, it holds the tendon of the tricep brachii in position. So we call that the transverse ligament. The other ligaments there, you will be okay. The muscles that make the rotator cuff, which ones?
Six.
Which ones are there? Supraspinatus, infraspinatus, teres minor. That's the key. Yeah. Don't confuse teres minor versus teres major. Now let's talk about those two a little bit. So when you look at the triceps are on this side, and the triceps are originating from long head of the triceps originate from the infraglenoid tubercle. The short head, the medial head of the tricep, you find the radial groove. Above the radial groove is the lateral head, below the radial groove is the medial head. All those go to one place, the Lacranian process. So all the triceps are going to one place, or Lacranian process. The long head of the triceps divides teres minor from teres major. Teres minor is posterior, teres major is anterior. So if this was the long head of the triceps, teres minor is this way, teres major is this side. That's the difference between them. Okay, the next set of ligaments I want to go through are the ligaments that are here. Again, those ones you can guess them. You can guess them. So you have the interclavicular ligament. That will tell you is the ligament between the clavicles. Costal clavicular ligament is right about here, and it's coming onto the clavicle and the costus. So that's the costal clavicular ligament. This way. This one right here. The interclavicular ligament is strengthened by other ligaments around it. And you have what we call the anterior sternal clavicular ligament, and there's a posterior sternal clavicular ligament. The ligaments on this side, the ones that are staying next to the sternum, we just call them radiate sternal costal ligaments. That's what I call it this way. All right, then we go to the next set of ligaments. The next set of ligaments I'm going to cover are the, I don't know what are the devices. No, that one. The ligaments are here. This one right here. They come here. Elbow joint. Elbow joint has medial ligaments and lateral ligaments. Medial ligaments are called medial collateral ligament or ulnar ligament, and these ones are lateral collateral ligaments. So let's begin with the lateral side. So here is radial collateral ligament. It is coming from the, again, I told a group of you who were here last time, if they asked you what the radiocollateral ligament originates from the humerus and attaches to A, radio, B, ulnar, C, something else. What would you choose? It is ulnar. So here we go. Here is the radiocollateral ligament, humerus, ulnar. This ligament actually makes four, is like a triangle. That's what it does. This is the annular ligament. This is what holds the radial head in position when it turns around. So then this is the radiocollateral ligament. The medial side is this way. Medial side, we have the ulnar collateral ligament. Ulnar collateral ligament is right here. It also is made of a diamond shaped line. There, there, and that. Yep.
On that last slide, the
Annular ligament. Radial
collateral ligament wouldn't attach to the radius and ulnar, just ulnar?
Yes, it does attach to the men. If they say annular ligament, they just say radial. If they say radial collateral, and just stick with that. Okay. So the ulnar collateral is on the ulnar side. The joint capsule is around it. Okay, then let's go to the. We done that? That we're done. Let's go to the hand right here. So we come down here. First of all, let's do the bones. The bones are 8 couple bones here. Let's begin from the. Should we begin? Which one is easier? Lateral or medial? Which one do you use? You want to start from the medial? Okay. She looks to pretty try to catch us. So S sky. Look to quitrum. Isoform. Trapezoid. Trapezium. Capitate. Hayman. What's special about the hayman? It has a hook on it, and there's a nerve that goes through that hook. And what did we say about the scaphoid? What's special about it? More subluxation bond in the top. Okay. All right. So let's look at the ligaments here. The flexor retinaculum is also called, the ligament is going to cover the area where you have the carpal tunnel. So palmar carpal ligament is this one. And all these tendons that go through there. Then this is the transverse carpal ligament, which is also called the flexor retinaculum. The other ligaments, you can make a guess very well. If a ligament is coming from the pisiform going to the radial, we call radiopisiform ligament. So those ones are not very difficult to do. In between the radius and the ulnar is a interosseous membrane. So that's again not very difficult to do with. So this is where you find, you can correlate them and know where you are, make a guess on it. So then let me give you an example. Here is a ligament you can guess on this one right here. From the pisiform to the metacarpal, you call it what? Piezo-metacarpal ligament. From the pisiform to the hamate, you call it what? Piezo-hamate. So those ones you can make educated ligament. I mean, educated basis on it. The ligaments that the ligaments that I want you to note are the disc. The radius participates in the joint, this joint. The ulnar does not. Let's remember that. So here we've got the joint. Here is a radius, here's the ulnar. So the radius is participating in this joint. The ulnar does not. The ulnar stops there. So if you do it this way, your radius is more having the impact. The ulnar is not, because the ulnar does not participate in the wrist joint. Between the ulnar and the wrist joint, there's a disc, and the disc is called articular disc. This is a disc. Between the ulnar and the wrist joint, there's a disc called articular disc, and that's the one that separates the ulnar from the metacarpal joints, which are these ones. All right, we'll continue with the ligaments. in the hand itself, these are called collateral ligaments. They're between the metacarpals and the phalanges. So metacarpals will come and end here, right about in here. We have ligaments that hold it. Then there are ligaments that hold the tendons where they should be so they don't snap off. And these are the ligaments we're talking about, these ones. We call them, let me use a different color. We call them the digital fibrous sheaths. They hold, like this so that the flexor digitorum tendons do not slide off. All right, we're about to get to the spine. Let's look at the lower limb first before we get to the spine. So we go to the lower limb. We come to about 3 ligaments I would like to deal with here. The first one is a wide ligament, also called ligament of Bigelow. It's the iliofemoral ligament. This one. This is said to be the strongest ligament in the body. It is going to prevent, I believe, hyperextension. Is that correct? Yeah, it prevents hyperextension. All right, then you have pubofemoral ligament. You can guess that's coming from where? Pubic to the femoral. And then you have ischiofemoral ligament. It's coming from ischium to the femoral, femur. That one, let me confirm something. What does that do? Does it prevent hyperextension? Hyperextension also, yeah. All right, so then we come to, I want to talk about the transverse acetabular ligament. The transverse acetabular ligament is this one. It increases the acetabulum by 10%. The size of the acetabulum is increased 10% by this ligament, the transverse ligament. Transverse acetabular ligament, this one. That's where, when you study the acetabulum, you have the acetabular notch. That's where it is. There's another ligament that we call the ligament of the femur. So here's the ligament of the femur. The ligament of the femur, this one. And this is a ligament that has an artery inside. A small artery inside it. Let me see if I can make it bigger. It has an artery inside it, and it goes to the fovea of the femur. So it supplies blood supply into the femur that way. The labrium acetabulum labrium is the one that goes around the acetabulum. This is acetabulum rami. And of course the femur goes in there, and for stability is a little deeper than the humerus. Let's go to the knee area. A few things to know about the knee area. The first one is standing with your knees extended is the most stable position for the knee. This is not stable. This is stable. Popliteus muscle is the one that makes you stable. So you come in this position, you'll be stable. Another thing to recognize about the knees, your knees depend on your the quadricep muscles for the strength. If the quadricep muscles are weak, the knee is weak. The reason is that the quadricep muscles contribute to the ligaments that hold the knee. So the patellar ligament is this one. See if I can make it a little bigger. Patellar ligament attaching to the tibia tuberosity. This is the tendon for the quadriceps femoris. And let's just read that now, another way there. So if you have the front here, so this is, you remove, this is quadriceps femoris muscle. This is what? Rectus femoris. This is vastus lateralis, vastus medialis, vastus intermediate. Come back this way, you have 4 muscles also. They're divided by the femoral nerve, not femoral nerve, but sciatic nerve. On the lateral side, there are 2 muscles, biceps femoris. And on the medial side, there are 2 muscles, semitendinous and semimembranous. There are three hamstring muscles, not 4, 3 hamstring muscles, which are semitendinous, semimembranous, biceps femoris, long hand. All those ones originate from issue tuberosity. That's what makes them upstrings. The muscle is on this side is not upstream, is biceps femoris, short hand. It's innervated by a different nerve. It also originates from a different place compared to the others. All right, let's go back to the knee. So the medial patellar retinaculum is on the medial side. Lateral patellar retinaculum is this one. It's all created by the extensions of the bicep femoris muscles. You can see the patellar ligament contributes to it, and then the lateralis and the medialis contribute to it. All right, on the inside, we call them the intra-articular ligaments. We have anterior cruciate ligament, posterior cruciate ligament, medial meniscus, and lateral meniscus. Anterior cruciate ligament prevents the displacement of the femur posterior. So if I don't have it, my femur will go farther away from the tibia. It will go backwards. The posterior cruciate ligament prevents the displacement of the femur anteriorly, so it's opposite. The anterior prevents posterior displacement, and the posterior prevents anterior displacement. The medial meniscus versus lateral meniscus. Lateral meniscus is circular. It moves easily. Medial meniscus is C-shaped. It doesn't move very easily. Medial meniscus is attached to the medial ligament, medial tibial femoral ligament. So I'm going to make this just a little bit bigger so we can see what we're talking about. So here is the lateral meniscus. So lateral meniscus is almost circular. It is not attached to this ligament at all. It's independent. So it freely moves. It's thinner, it's not thicker, it's thinner. Medial meniscus is C-shaped. It's attached to the middle collateral ligament. It does not move as freely as the lateral meniscus. You are more susceptible to having a problem with medial meniscus than lateral meniscus. All right, so those are the intrapatellar ligaments. So here is okay, this is another thing. The questions look very interestingly out of place sometimes. So the question may be like this way. The question may be, this ligament is attached to the lateral part of the medial condyle of the femur. And that would be? This ligament is attached to the lateral part of the medial condyle of the femur. Would be posterior cruciate ligament. See the wording, it's the lateral part of the medial condyle of the of the femur. And if the other way around, if you ask, this ligament is attached to the medial side of the lateral corner of the femur, then that will be ACL. That's correct. Now there's another ligament we call posterior meniscofemoral ligament. I'm going to bring it up and make it a little bit bigger. Here it is. And what it does, it just strengthens the lateral meniscus. So it's going to come from the lateral meniscus and attach there. Just makes it a bit stronger. All right, fibular collateral ligament is this one. It is also called lateral collateral ligament of the knee. This is the this is the medial collateral ligament. It's also called the tibial collateral ligament. This one, and as you can see, it's attaching to the medial meniscus, and you can see the lateral meniscus does not attach to the lateral collateral ligament of the knee. All right, we will then move to the joint between the tibia and the fibula. Let's begin with the anterior side. This is a capsule joint, and it is strengthened by, so first of all, your capsule joint by, there's another ligament over here. It will just be anterior tibiofibular ligament. There will be another one to the posterior side. And you would just call it posterior tibiofibular ligament. It will be right there. It strengthens the fibula and tibia bone. All right, we will go to the lower part. Before we do that, let's look at the fat pads and the muscles around it. So it's easy to identify them once you know what to call them. The ones above, we'll call them supra. The ones below, we'll call them infra. So let me say that again. This is the suprapatellar bursa. This is infrapatellar bursa. So this is a patellar ligament, and then underneath it is a cushioning of fat pad, or we call it just suprapatellar fat body, and then there is a bursa underneath it. So we have a bursa here, we have a bursa here. It is superficial, so we call it subcutaneous prepatellar bursa. This is another subcutaneous prepatellar bursa, and then this is a deep infrapatellar bursa. At the back, you have lateral subcutaneous bursa for the gastrocnemius muscle. And those are the bursas that you may be able to see, look at. So we have the suprapatellar bursa, infrapatellar bursa, and then you have, so for my patella to move easily, it has to move. So when I move, the ligaments are not crunching on the bones. There is a cushioning between them. So on top of the patella is subcutaneous prepatellar bursa. Below the tendon, the patella tendon, is subcutaneous infrapatellar bursa. Deep to the patella is the suprapatellar synovial bursa. And underneath is deep infrapatellar bursa. All right. We will then go back to the fibula and the tibia. So you come down to the foot, and the biggest thing that unites the fibula and the tibia is the interosseous membrane. Let's talk about that a little bit, muscular-wise. So we need this muscle. It's coming here. So here, you divide your leg into 3 components. This is the tibial bone. There are no muscles on top of it. This is considered posterior. This is considered anterolateral. This is considered lateral. There are 3 muscles here, actually 4. The one that's closest to the tibia bone is tibialis anterior. And then the one that's going to the fourth tendon is called not before the fourth. Extensor hallucis longus. And then between those two, there's another muscle. Extensor hallucis longus. So let me go through that again. So you have three muscles. Actually, there are four muscles. Let me talk about the three first. Close to the tibia is tibialis anterior. Then lateral is extensor digitorum longus. And then between the extensor digitorum longus and tibialis anterior, there's another muscle you see from here is extensor hallucis longus. And then underneath here, we only have two muscles on the top here, just two muscles, which will be extensor digitorum brevis and what? I need to do something so this it doesn't die. Just to tell you that I'm still alive. That's good. And an extensor hallucis brevis. Is there something behind this thing? All those ones are in front of the lateral malleolus. All of them. There are two muscles. There's another muscle here. It's peroneus tertius. Peroneus tertius comes to the front. And then there are two muscles that go behind the lateral malleolus. Just two muscles. Those will be now. And peroneus. Oh, you said one of the other. But those are the muscles. All right, let's talk about the innervation of those areas. The innervation of those areas. So the sciatic nerve comes this way and then divides into two nerves. Tibial nerve and not sure. Tibial nerve, common peroneal or common fibula, same name, same thing. So all the muscles behind here are innervated by tibial nerve. Common fibula innervates anterior and lateral. So deep to the, between the tibialis anterior and extensor digitorum longus is deep peroneal nerve, which innervates this area and it comes out to the front. Then superficial peroneal nerve goes to peroneal brevis and peroneal longus. So that's innervates this side. And then the sural nerve is going to be in the middle. There's a contribution from the tibia and the condylarthra and stays in the right. Oh, we do that again? Okay. So the innervation of this area. So sciatic nerve remains sciatic until it splits. When it splits, it stops being called sciatic nerve. The one that will go to the lateral side is common fibula. The one that stays in the middle is called tibia. Don't say posterior tibia, just tibia. The artery is called posterior tibia. The nerve is just called tibia. So when we come here, deep peroneal nerve innervates the muscles to the front, which will be tibialis anterior, extensor hallucis longus, plus digitorum longus, and tertius. Extensor digitorum, yes. Okay, then on this side, you have two muscles, but the nerve that goes there is superficial peroneal nerve, innervated in this area. So the anterior side then, so the deep peroneal nerve goes up to the dorsum of the foot. The superficial goes to the right side of the foot. The sura stays on the top here, and then the tibia comes all the way. The tibia comes to the side, which will have the medial and the lateral plantar nerves coming from the tibia. So everything underneath here is tibia. All right. Well, she's still alive. Okay, so those are the muscles of The ligaments here, you can guess these ligaments. You can guess when you ask, for example, oh, come on, wake up, there we go. So you can guess the ligament between the tibia and the fibula that's posterior will be posterior tibiofibular ligament. I don't think it's me. Just something going on with that there. But the main ligament, if you ask you the main ligament between the tibia and the fibula, it's actually the interosseous membrane. That's the one that holds them all the way from the top. All right, so then, let's talk about the arteries, because I saw a sample question on that. I'm not saying that's going to be there, but I saw a sample question on the arteries. So the arteries go this way. Femoral artery, which is a continuation of the external iliac artery, crosses over the inguinal ligament and becomes the femoral artery. So it comes, gives us deep femoral artery, which then gives blood supply for everything here. Then you continue down, goes to the adductor canal, then comes to the adductor hiatus. When it comes this way, it comes and turns, changes, and comes to the back. At the back, it divides into two arteries, which will be anterior tibia and posterior tibia. Anterior tibia runs with which nerve? The peroneal. And then goes all the way supplying the muscles here. Posterior tibia goes back and gives us a branch, which is fibular artery, and supplies the muscles on the lateral side. Then posterior tibial artery continues together with the veins and comes to the plantar side of the foot. This is another thing you need to remember. Although we call this is dorsiflexion. It's called dorsiflexion. But the muscles, which muscle does dorsiflexion of the foot? Don't be confused by the word dorsiflexion. It is going to be tibial anterior extensor. Correct. So those ones extend. Dorsiflect the foot. The other side is plantar flexion. All right. Then let's go to the. I don't have the watch. What time is it? Okay, we have a few minutes. Let's do this one a little bit. This is where you can guess and others you cannot guess. Come on, there we go. So let's look at the collateral ligament of the ankle. There are four parts of it. So this is posterior talofibular ligament. It's from the talus to the fibula. This one is posterior talofibular. This is calcaneofibular ligament. This is anterior talofibular ligament. All those are related in protecting this bone. Dr. Moore actually uses the word subluxation. He says these ligaments prevent this bone from subluxating. So there are four parts. We have femoral talofibular, calcaneofibular, and anterior talofibular. They are all part of the collateral ligament of the ankle. So all these are collateral ligaments of the ankle. On the medial side is a ligament you're probably aware of, and I told some of you last week that that's the one I was tested on during my board exam. I just remember it stuck in my mind all these years. Is the deltoid ligament. The deltoid ligament is also in several parts. So deltoid ligament is, come on, stay alive, stay alive. It is posterior, talo, tibia, talocalcaneal, talonavicular, and anterior talo ligament. So this, that, and this is a deltoid ligament. I guess it's because it looks like a triangle. That's the lateral side. Medial side, I'm sorry, that's medial side. That's the medial side. All right, some other ligaments that are interesting is your probably some of you know about it, is the spring ligament. The spring ligament is the main ligament of the arch. And here it is. Come on. There we go. Here is spring ligament. It's calcaneonavicular ligament. It's the main ligament of the arch. Let's see how much time we still have. Maybe very little. I need to complete this. Okay, the other things you know, let's just run through them. You're pretty good with it. Yes, sir.
You said spring ligament is tallow.
I'll take you back there. Calcaneo, plantar calcaneonavicular ligament. All right, let's flash through this quickly, then we're done. Let's go to the spine. The ligament in the front of the spine is, the spinal column is ALL, which prevents hyperextension. Behind it is PLL. Okay, the ligament on top of the spinous process are supraspinous. In between is interspinous. Then you have articular capsules on both sides. The main ligament of AA joint is transverse ligament. Okay? Transverse ligament is the main ligament of AA joint. Okay, the ligament behind, between atlas and occiput is posterior atlanto-occipital membrane. If it calcifies, it forms posticus ponticus, also gives you the first false IVF. The ligament from the tip of the dens to the occiput is apical ligament, the remnant of the notochord. Membrana color is a continuation of the PLL between atlas axis and occiput. What other ligaments are? So those ones I think you can dig around and find them if the worst came to the worst. What else do I have? I have two more. Well, the most elastic ligament in the body is the yellow ligament. I'm trying to make sure we can get as much as we can get. I think that should be okay. You will survive. You will live. Okay. Thank you for coming.
The yellow ligament in the limb, the body?
Yeah.
And that, actually, here? Okay.
Ordering this.
So that is, what am I? Deeper than the.
You have to remove the lining.
the